Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to our CodeCast podcast today. For those listeners new to the podcast, first of all, thank you for searching us out. We appreciate the downloads. And actually, we're now number one for the medical coding and billing search for iTunes. So that's very exciting news. We saw that this week. So that was kind of nice to see that we are number one on that platform. I'm also finally feeling like myself again. So my voice is pretty much back to normal, maybe about 90%. So I'm good this week. This is going to be a good week for me, and I'm excited about that. Before we dive into today's topic, the CodeCast podcast is brought to you by Advanced MD, spotlighting telemedicine as a solution that's proven to boost patient engagement and bring the new revenue streams to your practice, advancedmd.com. And Healthcare Executives Network is the fastest growing community for healthcare executives and their trusted partners, healthcareexecutivesnetwork.org. Okay, so one of the things we're going to do today is I'm actually going to take a different direction on what I want to talk about. I'm going to still stick with my core medical, but there's some things that have been coming up in the recent weeks and months, and I've noticed that the articles and some of the, programs have really focused on physician burnout phenomenon. And it's pretty interesting how, they really focus, when I say they, I'm just saying in the industry, focus on the physician. And I really want to talk about really looking at this from our perspective. So seeing how physicians are dealing with that, it really got me thinking about the staff. And that means us, the billing and coding professionals, administrators, front desk, insurance collectors, patient account reps. You are all in the workforce as well, right? And it is a highly stressful job. People may not realize that, but we deal with the public, we deal with sick patients, we deal with families, and we just deal with people who really aren't happy to be in your office or want to be. And we not only have to empathize with their situation, but talk to them about money and reimbursement and how contracts work without trying to get too involved emotionally in their plight. And that's really hard to do and still try to enjoy and love your job. So I want to look at this from a perspective of the staff and, again, professionals in this genre, in the medical field, that aren't physicians. So we're going to just talk to the staff here. And are we headed towards burnout? And I really wanted to do some research on this and just see, what is everybody doing? How do they kind of get their what I like to call a little mind vacation? But I wanted to first, dive into this a little bit further and just look at vacations in general and find out. I remember years ago when the job market was really tough, I would sit on a bus or something to get my rental car when I was at going to one city to another from the airport. And I remember a conversation with a couple of gentlemen that were, in the corporate world, I think pharmaceutical companies, and they were saying, no, I've got 54 days of vacation saved up, but I don't dare take it because somebody will take my job. And I thought, how sad is that you have this built up and you can't use it. And then I was hearing the next gentleman that was sitting with him, he basically said, and if we don't use it, we lose it. So it's a catch-22. So I really wanted to look further into this, and I found an article from Inc. magazine. It's a digital magazine online, and it told kind of an interesting story. It said that fewer American workers are taking vacations, costing themselves up to $62 billion by forfeiting around 212 million days that could not be banked, rolled over, or paid out. And this is a direct report also from CNN. In total, Americans gave up 705 million vacation days last year, and according to Project Time of Off State of the American Vacation Report in 2018, on average, Americans take 17.2 days of vacation each year, which I actually thought was high, but it's a drop from the 20.3 days of vacation from the late 1970s to 2000. So most Americans who don't use their vacation days worry about how people perceive them at work, and I'm sure you're one of them. And although research shows that those who travel or take a vacation and take that break tend to be happier in both their professional and personal lives, you have to think about that when you're thinking about burnout and how do you feel and are you excited to get up to work every day? And that's really what I want to just kind of talk about, because I think that as professionals, especially in the medical field, and I'm not saying, we're forgotten, but it's not just about the physician all the time. It's also the staff. And We are there to not only keep them compliant, make them money, but also we're the first face that the patient sees. It takes a few staff members to get to the physician. So I would think that it's important to know what we can do to make sure that our jobs are something we want to make better and really be the best face we can be for that job. The only way I can really dive into this is kind of tell you what I'm dealing with on any given day. And hopefully this doesn't give you too much of a headache, because I know my day's probably a little different than yours. But if you walked into my home office, you might think you were in a spa. The walls are painted a soothing sand color. At least I think it's soothing. Reminds me of the beach. A scent diffuser releases a pleasant tea tree oil scent, good for the voice in those days when I present webinars and record podcasts. And my beach wave sounds are my zen, so that's meditation music playing softly on an endless loop. Wait, then I wake up and the reality is, so I'm kidding you guys, that's not how my office is. At second glance, you would see an enormous desk cluttered with 2 large computer monitors, 2 fax machines, and I know some of you aren't using fax machines anymore, but I do. Multiple code books, copies of articles I've printed with the intent to read, and sometimes I do get to them, notes for upcoming podcasts, and webinars, medical records for audits, and my planner open to the current week with color-coded notes regarding weekly meetings, to-do lists, and deadlines. So it might seem like a stark paradox, but I like to call it kind of balance. It's taken me a lot of years to achieve what I'm dealing with here, but did I mention that Mondays are my rap hip-hop days? So I play it very loud. I only like a few rap artists. My music producer, Disassin, is one of them. And when I play his music, I absolutely can focus on my work. And so there's a few of them that I like. I'm not really into the guys that are kind of in the pop genre and call themselves rappers, but that's me. But now you know why I also needed a satellite office away from my home as well, not just to break up the monotony, but I just needed more space, and not to mention, believe it or not, home offices, when I'm not traveling, they can be even more distracting. I have an adult daughter who's in grad school, and she loves to come in my home office and interrupt my work. And thought processes, I can be right in the middle of something, and she's like, "Oh, Mom, I want to tell you a funny story." And I'm like, "I'm working here." But then I feel bad because, again, those of us that have adult children, they're going to be gone soon from home. Well, at least I'm praying she's going to be gone soon from home. But what I'm saying is that you don't want to also miss those moments where they talk to you. So there are days I find myself in one of my offices on a Sunday when it's sunny outside, but I live in Southern California, so that does happen a lot. But I'm under deadlines, or I have a new business idea, and I'm always coming up with something that I feel I need to put into action immediately. But then I realize my husband and my family and my friends are like, "Where are you?" So for me, burnout comes and goes. It really does. But my realization of the fact that I needed to take a step back and really try to balance work and leisure time to be an effective businesswoman was my first step in avoiding really frequent burnout. So for coding and billing professionals like ourselves, burnout can hit you when your professional goals are not in line with your company's mission. And so that can be frustrating as well. The frustration you feel when you know how things should be done or how you can make the processes better and then how it is done is like trying to put a square peg in a round hole, and sometimes it just doesn't fit in. I actually had that happen to me today, where I was on a board for a company putting together a curriculum for billing and coding, and I said, I'm going to step back. I just wasn't feeling like it was a good fit, seeing the direction they were going in and seeing what I really wanted as far as input. Because to me, if you're going to take a billing and coding course, especially if you're going to put the money in, that means that you should be able to get a job once you're done. And I just didn't see that happening. I saw it just making somebody else a professional student. So sometimes that you just have to look at those things and realize that you have to take a step back. So when we look at those, and over the last 2 decades for me, so 20 years, I've been a national speaker, spent hundreds of hours training coders, written thousands of pages of coding training materials. For those who've read my articles, and I do audits for Medicare as well as private associations and private offices. It's interesting that even with these achievements, this came after 2 brutal bouts of burnout. I mean, where I basically was like, I just don't think I can really continue with this. And it's embarrassing to say that I went through all of this as a traveling consultant with a spouse and a child. And because, again, having a family puts a new spin on things. And even though, again, my daughter is an adult now, My career has now taken on a second life after over 25 years in the industry. I think I'm almost at 30, and it's still demanding, which I love. I mean, I've had a second wind now, but you're probably thinking, okay, how do you manage it all? And full disclosure, there are days that I don't, where I'm thinking about 2 o'clock, which actually I'm recording right now around 2 o'clock in the afternoon, and I'm thinking a nap would be awesome right now. But for the most part, I am on top of it, and I have figured out that there are strategies to avoiding burnout. And so hopefully I'm going to give you a couple of tips, and I'm actually going to have to give you 10 tips. I like that number. And hopefully this helps you as well. It's just realizing and what to remember, and hopefully this will just give you maybe some insight as you're moving through your day and thinking, I just need a break. And this will show you that it's not just about having a break when it comes to burnout, but it's about the direction of your career as well, and making sure that you're on top of it and understand what's going on. So first of all, I would say find a good mentor. And this is someone that, that has what you want out of life, and you see how they manage it. And, I have people all the time tell me, I really want to model my business after what you've created here, Terry. You've really worked from the bottom up, and I appreciate that and everything. But when it comes to career-life balance, that's where I probably lack a lot of skills, and I'm really learning the process. And when I'm looking at that, I do have a mentor. I call him my life coach. And I mentioned him before, my music producer for my podcast. He's a lot younger than I am. And maybe he's learned some lessons that I've had to figure out the hard way. And when he's also got small kids and a family. And so I just remember him telling me recently, you can have it all, but not all at once. And that really stuck with me. There will be times when you need to focus on your family, and it does affect your job. And then there's times when you have to focus on your job and it takes away from your family. But accepting for me that I can't be everything to everyone at the same time is something I remind myself every day. And it's really about managing priorities. And so just keep that in mind and try to find somebody that really can help you kind of talk you down off a cliff and reassure you that you're doing a great job. Just take a step back once in a while. Another thing is to make lists. There's an internet meme out there that says the biggest lie I tell myself is I don't have to write it down. I make lists, and I make lots of them. I even carry around a list in my phone. And at least the lists take some pressure off, because they don't have to clutter up my head of remembering everything I have to do tomorrow. And tomorrow is a big word for a lot of you. So, excuse me, these are things I don't need to worry about now, but I know I need to get to. And I'm always checking my list. So make sure you do have some way to make a list. And one of the keys as well, and I know we all have our phones, close to us, but I have a pad of sticky notes and a pen next to my bed, because sometimes I'll think of an idea or something I want to add to my business plan, or something I need to tell somebody, and I write it down. Because sometimes, by the time you pick up your phone, put your thumbprint in, get to the screen you want for your notes, somebody's walked into your bedroom or your living room, and you're distracted, and then you forget what you were going to do. So try to have that pen and paper handy. Also, work when you're most efficient. This is number 3. Many coding professionals work from home now, which means they can usually make their own hours. If you're most efficient at 5 a.m., when the rest of your family is sleeping, that's when you should do your work. I'm at my most productive when I wake up early, shower, get into my quiet office by 6 a.m., and I get so much done before noon that I have to remember to stand up actually on occasion so my feet don't fall asleep. But if you work on site at your medical practice, which I know most of you do, have a sit down with your boss, your administrator, and if you're an administrator, do the same with your physicians and ask if you can flex your hours. It's harder if you're in the management position because you're also in charge of people. But a lot of times now, if you can come in before everyone else, some days when it's quiet, and if you're on the West Coast, you can talk to the East Coast. And if you're on the East Coast, you'll get all that paperwork done before anybody or any phones are around to interrupt you. This is an age where more and more employers are really learning to be a little bit more flexible with hours, schedules, and life-work balance. So especially if you're a certified coding professional or billing professional, and they're hard to find. And so, and somebody with your experience. So make sure you have that conversation. All they can do is say no, but it's something to definitely ask for. You never know what they could say. Next is focus on the sustainable. When I took swimming lessons, the instructor said consistency is the key to being good at any sport, but I think it's a key to a successful life as well. If you can't do something with consistency, then you can fail. If what you're doing isn't sustainable, it can lead to burnout. A good example would be these podcasts. So you all know that they're going to drop every Tuesday, rain or shine or without fail. So be accountable for what you promise, what you do, and that will make your self-worth very settling. It's a good feeling to know that you've kept your word, that you finished your what you said you were going to do by the date you're going to say you're going to do it, and it does ease some of that stress. Pick one thing off that list. Inaction is not an option. You have to do at least one thing. There are days when your to-do list seems insurmountable. I have one right now that has 2 pages on it. But my latest strategy is to just pick one thing that must be done and completed. And granted, again, there may be more than one thing that needs to be done today, but you have to start somewhere. And finish that task before you move on to the next one. One thing I tend to do, unfortunately, is I tend to start many projects and then before finishing them, and you have to finish to feel accomplished. Get that so you can cross it off your list. I'll start an email and then I'll be like, oh shoot, I meant to send one to somebody else. And then I'll be like, oh, I need to look this up. And I'll be like, Terry, just stop. Make sure you finish what you're doing right now, finish that thought, send that email, and then move on to the next. Then it can also relax your brain as well. You aren't stressing and saying, oh shoot, I still need to finish this or that, and it's 6 o'clock at night. One of the big things is surround yourself with people who know your limits, but also know your expectations. So are you the person that volunteers or agrees to do everything, even though you know you don't have time to do it? I am one of those people. So let me be the one who puts the focus on sustainable statement in your head. The second part of this, of course, taking that advice and learning to say no when you're overextended. When I mentioned I did that today, I was asked to take on another project, and it was just not something I knew I could fit in, and I really didn't feel like I was a fit for the project. And it also, if it doesn't have the revenue stream that you're looking for to make time for it, learn to say no. Or just say not now. So you want to be able to surround yourself with people that know your limits. Next, and I'm sure you've heard this, go for a walk. And if you don't have time to go for a walk, think about this. How much time do we waste being upset or feeling stuck while working on a project at work? You can either sit at your desk and be inefficient for another hour or more, or take a quick 10 to 15 minute walk to clear your head. Even just get up, walk outside, and let the sun shine on your face. If it's raining outside, just look up. Just make sure that you're getting some of the rays out there. If you have my Irish skin, you might be getting a sunburn in that time frame, or even a freckle. But hopefully you'll get a tan, or you'll get at least that gray tint, we all hope for at the end of May, into June. But you'll get your second wind. And when I say get up and take a break, do not get on your phone and look at social media. We all do that. We're saying, I'm going to take a break right now, and then everybody's on Facebook and Twitter, and I'm definitely a culprit of that, and I need to stop doing that. And I have really kind of pulled back from that quite a bit. I have certain times of the day where I will take a look. I'm not on Facebook. I'm actually banning Facebook. It bugs me. But as far as Instagram and Twitter, I'm very heavily involved, especially on Twitter with my sports. But make sure that you really take that break. Otherwise, you really can kind of glaze over. Now, this next one is separate your home and workspace. And this is tough. I know I mentioned kind of before how mine works out. But the great thing about working from home is you can work anytime you want. And then the bad thing about working from home is that you can work anytime you want, even if you don't want to. So setting boundaries is important. I set specific business hours for myself, or at least I try to. And I treat my office at home like the one outside the home. I don't spend time there when I'm not working. In fact, it should be your dustiest room in the house, because you need to train yourself not to go in there on the weekends, or at least not on Sundays or the day off that you have during the week or that you give yourself. And only certain kinds of people can work from home. Not everybody can do it. With remote coders and billers really being part of the norm now, make sure you don't spend more time on that laundry or the dishes or house chores before you even step foot into your office. That's not efficiency in your work, that's efficiency in your chores. And then follow your bliss. The best career advice I could give to anyone: don't follow the money or the pathway somebody thinks you should. Find your niche. Find your niche and really find what you love to do and find the job that fits that. But realize that businesses evolve, and there may come a time when your bliss doesn't align with your employer's organizational goals or with what you like to do anymore. One of the things that I do is, and I've mentioned this, I'm a big in auditing. It used to be 20% of my business. Now it's 80%. I'm still obviously educating in webinars and seminars and, all kinds of different modules. But I have just found that really where some of the lucrative options are are really in auditing, and because it has to be done, offices have to really look at their goals and their compliance. But the thing is that, do you like doing it? Now, I'm not saying it's not a grind, though it can be, but really kind of diving in and how interesting it is and finding those things. And I mentioned last week, I love coding. I just really like, figuring out that puzzle of coding. And remember, there's no career that provides instant financial reward no matter what anybody tells you. It takes time. With patience and dedication, a career in the medical field can be not only lucrative but rewarding, but you have to follow what you love to do. If it's not coding and you really like being a collector, do that. If you'd rather, when you go home at night, not think about your job, say you want to be at the front desk again. That's basically all about patient, care and greeting and really making them feel like they want to come into your practice. So really understand what makes you happy in all this. Find ways of incorporating self-care in your daily routine. So I'm not talking about, massage or meditation, unless that is what you want to do, and if you have time for it. It could be something as simple as reading for pleasure for a few minutes before bedtime, or again, that quick walk you took earlier to clear your head, or making your office feel like a spa. It doesn't have to take a lot of time, but do one thing for yourself every day. One thing I do, and I probably shouldn't do this every day, but it's really something I do for myself. I grab myself a Starbucks iced tea. I do sit out either on my deck when I'm not traveling. I actually live on a golf course, so you can tell why I live on the first tee. And just kind of look out there. I've got beautiful trees that move. I've got crazy golfers that hit golf balls towards my direction, which I don't know if they're aiming for me or not. Maybe I need to think about that. But just kind of, sitting out there and looking at how beautiful it is. And we also have a water feature. I also turn off my phone by 10 p.m. every night. Let me rephrase. I put my phone on silent, so I still have my favorites that can get a hold of me if they have to, but I really try just not to look at it and put it on silent. And I also love my home improvement shows, and I love sports. So when I can watch my Pittsburgh Steelers play, I also, in my spare time, I write articles and do podcasts on Steeler football. I like Pirates football. I used to like Dodgers, but they don't put them on TV here in Southern California anymore. And even a rerun or an episode of Fixer Upper. I know some of you know what that is on the HGTV, but it's all about balance, and I call it a mind vacation. Doing something that you really just want a chance to get away from work. I'm in a book club. I started a book club actually a year ago, and it was only supposed to be 5 of us, and I had women of all professions, and actually part of a wine club I belong to, basically saying, "Oh, Terry, can we get in? Can we get in?" And now there's 10 of us, and we all pick a different book at each month. It's once a month, but it's just so nice to be able to really just have a group of women that you consider your friends, your acquaintances, your colleagues, whatever, and have these discussions. And yes, there's wine drink. I'm going to put it out there. It is, but it's just nice to make time for that. And that's the funny thing. A lot of people said, "Oh my gosh, I'm so glad you created this because you actually make time for it." The one funny thing about it is I've got 2 male friends that are like, "Can we join too?" I'll have to think about that. I'm not really sure if we want to let them join, but they are pretty funny, so we might have to think about that. But it just gives you that balance there. You have to make time for your friends. If you keep saying no, you're not going to be invited anymore. And then lastly, I heard someone say to change your phone screen to black and white for the weekend. It will lessen the overstimulation you get from your electronic device, and you'll look at it less. So I might have to try that. I have not tried that one yet, but that is one I recently read, something that Bill Gates had done, and I thought that was interesting. So hopefully you found some of this, helpful today. I'd like to end with our final sponsor, Women in Healthcare UK. Women in Healthcare is a community for healthcare professionals aiming to provide a platform for women within the healthcare sector. Since 2001, England, United Kingdom. Yeah, one thing I actually didn't realize until I started looking at podcast stats is how big we are in England and Germany and India. We're really reaching not just through the country, but also outside the country. So that was kind of nice to see, and they asked to be a sponsor. So we really like that and appreciate that. So for anyone who was listening in today, I really like feedback, and I've gotten some just awesome feedback in the last couple of weeks about the podcast and what you're getting out of it, and I love to hear from you. So on this topic of burnout, if you're feeling burnt out or you're finding ways to avoid burnout, or if you've had it in the past, send me a message. Send me a quick email, terryfletchercpc@aol.com, If you just can't bring yourself to send an email to AOL, okay, don't at me. I also have an email on Gmail, terryfletcherccc@gmail.com. Or you can find me on Twitter at terrycoder1, and you can direct message me and follow me on there. And I'd love to hear from you. Let me know what you're doing to prevent burnout now and actions you're taking to prevent it in the future. So it's been great talking with you today. Also making, just having a little bit of a different topic. I did want to end with our coding question. Remember, we do one coding question every week at the end. If I'm not doing my top 12, so I just want to make sure I put that out there. And the code question basically said, Terry, how do I code for the toxic effect of venom of bees? And so now we're almost in we're right end of the spring season and getting into summer. So the code is T63.441A, and the 7th digit is for the initial encounter. Remember, T codes are injury too, so a bee sting is actually considered an injury too. And that was our coding question on our CodeCast podcast. So everyone, make it a great day, and thank you for listening in today, and I look forward to talking to you next time.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at terrycoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.